Assalamu alaikum students. Today we are going to discuss about the hip bone. So this is the hip bone. Hip bone is actually a flat bone, a large flat bone, a long bone. Hip bone is divided into three parts: an ilium, the upper expanded part, the pubis, the anterior part, and the ischium, the posterior part. For side determination of hip bone, we need to remember 3 points. Firstly, this cup shaped structure is known as the acetabulum. So this acetabulum is directed laterally. Secondly, the ilium is above the acetabulum. And thirdly, the obturator foramen is below the acetabulum with the pubis in front and ischium at the back. So 3 points: acetabulum is directed laterally, ilium is above the acetabulum, pubis is anterior to the obturator foramen, and ischium is posterior to the obturator foramen. Now when we start with the hip bone, we have 3 parts, as I already told you. This is the ilium. The flat plate like expanded upper part is known as the ilium. Then we have pubis, which is the antero-inferior part, and lastly we have ischium, which is the posterior-inferior part. Starting with the ilium, this is the long expanded plate like part which is known as the ilium. Ilium is divided into an upper end, this is the upper end, a lower end which is forming upper 2/5 part of the acetabulum, the upper end, the lower end. Then we have 3 borders: anterior border, this is the anterior border, posterior border, this is the posterior border here, and a medial border. So we have 3 surfaces also: an outer surface or the gluteal surface, an iliac surface, and a sacropelvic surface here. So starting with the 3 surfaces, the gluteal surface. If we look at the gluteal surface, we have 3 lines over here which is dividing the gluteal surface into 4 segments or 4 parts. The posterior most line is known as the posterior gluteal line. It extends from the posterior inferior iliac spine up to the iliac crest. This is the iliac crest. Then we have an anterior gluteal line and we have a inferior gluteal line. The anterior gluteal line also extends from the upper part of this notch, and it extends up to the iliac crest. Lastly, we have the inferior gluteal line which extends from the sciatic, this notch, and it also extends till this prominence. So it divides the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line, divides the surface into 4 segments or 4 parts for different muscular attachment. And if we look at this surface, this is known as the iliac surface or the iliac fossa. As you can see, this is a deeper structure here, this is a groove like structure here, or the fossa. So this is the iliac fossa or the iliac surface. Thirdly, we have another surface which is quite roughened here. This surface is known as the sacropelvic surface. Sacropelvic surface is divided into upper roughened surface, which is the iliac tuberosity, ear-like surface, which is the auricular surface, it is the articular surface, middle one. This is the iliac tuberosity, this is the auricular surface, and below down we have a pelvic surface which is smooth. This is the pelvic surface. So an iliac surface, an iliac tuberosity, the auricular surface, and the pelvic surface. So these were the 3 surfaces here. You can see a hole or a foramen here which is known as the nutrient foramen, and it is for the nutrient artery to supply nutrition to the bone. Now we are going to discuss about the iliac crest. So iliac crest is the upper end or the upper part of the iliac bone, the ilium, sorry. It has an anterior end. This prominence anteriorly is known as the anterior superior iliac spine, and just below this prominence we can see another prominence here. This is known as the anterior inferior iliac spine. So anterior superior iliac spine and anterior inferior iliac spine at the anterior border. Posteriorly, we can see posterior superior iliac spine, another prominence here, just as anterior one. This is the posterior superior iliac spine, and we can see another prominence here, which is known as the posterior inferior iliac spine. So posterior superior and posterior inferior iliac spines respectively, forming the posterior border. The iliac crest extends from anterior superior iliac spine anteriorly and extends backward till the posterior superior iliac spine posteriorly. The iliac crest is divided into three parts, you can say, that it has an outer lip and inner lip and an intermediate area. So the outer part or the outer margin is the outer lip. The outer lip has a prominence here, just anterior to the middle of the crest. Then you have an inner lip here and an intermediate area. These are also important for different muscular attachments. Now, as we have discussed ilium here, we are going to discuss few attachments of ilium. So attachments include, if we look at the anterior superior iliac spine here, the anterior superior iliac spine is attached to the lateral end of the inguinal ligament. It also gives origin to the sartorius muscle. Now, if we look at the outer lip of the iliac crest, the outer lip of the iliac crest gives origin to tensor fasciae lata. It also provides insertion to external oblique muscle. It also gives origin to latissimus dorsi just behind the highest point of the crest here. Now, the inner lip of the crest. The inner lip of the crest provides attachment to transversus abdominis in its anterior 2/3. This is the anterior 2/3. It also gives attachment to fascia transversalis, and it also provides origin to quadratus lumborum in its posterior 1/3. Now, the intermediate area. The intermediate area gives origin to the internal oblique muscle in its anterior 2/3. The dorsal segment of the crest, this is dorsal segment of the crest, and this is the ventral, as ventral indicates the anterior and dorsal indicates the posterior. So, the dorsal segment of the crest gives origin to the gluteus maximus in its lateral side. Medial side gives origin to the erector spinae. The upper half of the anterior inferior, this is the anterior inferior iliac spine, the upper half of this gives origin to the rectus femoris muscle. The rough area below this spine gives attachment to the iliofemoral ligament over here. Piriformis muscle fibers originate above the greater sciatic notch. So, this is the greater notch, which is known as the greater sciatic notch, and piriformis muscles arises from here. Now, the gluteal surfaces, when we see the gluteal surface, this is the posterior gluteal line, and behind the posterior gluteal line we have this area. It gives attachment to gluteus maximus muscle. Then we have this anterior gluteal line. So, between the anterior gluteal line and the posterior gluteal line, there is an area which gives attachment or origin to the gluteus medius muscle. Then we have an inferior gluteal line. So, the area between the anterior and the inferior gluteal line gives attachment to the gluteus minimus muscle. Now, we have another area which is just below or inferior to the inferior gluteal line, and it gives origin to the rectus femoris muscle, this area inferior to the inferior gluteal line or below the inferior gluteal line. Now, this acetabulum has some margins, and this margin gives attachment to the hip joint, to the capsular ligament of the hip joint. Iliac fossa gives attachment to the iliacus muscle. The lower grooved part is covered by, this lower grooved part is covered by iliac bursa. So, iliacus muscle here and iliac bursa here. The iliac tuberosity, which is the roughened part, it gives origin to, it gives attachment to interosseous sacroiliac ligament, dorsal sacroiliac ligament, and iliolumbar ligament. Now, we can also appreciate a sulcus here just above this notch, which is known as the preauricular sulcus. Okay, this auricular area or auricular surface gives attachment with the, it articulates with the sacrum. It is the articular part, and it forms the sacroiliac joint. And just below it, we can feel a sulcus here, which is known as the preauricular sulcus, and it gives origin to few fibers of piriformis and obturator internus muscle. Coming below, this is the acetabulum or the acetabular cavity where the hip joint is formed when it articulates with the femur. Just below the acetabulum anteriorly, we can see another thickened bone or a part of this hip bone which is known as the pubis. The pubis is divided into body, superior ramus and an inferior ramus. So, the body has three surfaces, an anterior surface, a medial surface and a posterior surface here. So, anterior surface, this is the anterior surface, this is the medial surface and this is the posterior surface posteriorly at the pelvis. The superior ramus is arising superiorly from the body. You can see a prominence over the body here, this is known as the pubic tubercle, and a sharp line is also arising from this pubic tubercle up to the acetabulum, which is known as the obturator crest. Here you can also appreciate a line behind the pubic tubercle, a sharp line. It is known as the pectinate line or the pectineal line, which continues above, known as the arcuate line, which further continues with the medial border of the ilium. Here we have the inferior ramus and here we have the superior ramus along with the body of the pubis. So, the superior ramus has three borders and three surfaces. It has an anterior border, a superior border and an inferior border. Anterior border is formed by the obturator crest, the superior border is formed by the pectinate line and the inferior border is formed by the upper end or upper margin of the obturator foramen. So, we have three surfaces here. This is the obturator surface, this is the pectineal surface and we have a pelvic surface here. Obturator surface is between the inferior border and the anterior border. So, anterior border and inferior border, this is the obturator surface. Then we have a pectineal surface between the pectineal line and the anterior border. This is the pectineal surface and we have a posterior surface or pelvic surface which is between the superior border and the inferior border here. So, this is the pelvic surface. So, obturator surface, pectineal surface and pelvic surfaces. Now, coming over the inferior ramus is just going behind and it is joining the part of the ischium which is the posterior bone. So, this is the inferior ramus which is joining the ischium bone posteriorly. Now, looking towards the attachment of pubis, as we have already discussed, this is the prominence which is known as the pubic tubercle here. Pubic tubercle gives attachment to the inguinal ligament and cremasteric muscle. In males, this tubercle is crossed by the spermatic cord. Now, the pubic crest, here you can see the pubic crest. The pubic crest gives origin to rectus abdominis and pyramidalis muscle. Now, the anterior surface of the body of pubis, it provides attachment to the anterior pubic ligament. It also gives origin to adductor longus, gracilis, adductor brevis and obturator externus. Now, the posterior surface of the body of pubis, the posterior surface gives origin to levator ani muscle, obturator internus muscle and it also gives attachment to puboprostatic ligament. Now, if we see the pectineal line here, the pectineal line provides attachment to conjoint tendon, pectinate ligament, lacunar ligament, pectineus muscle and its fascia and psoas minor when present. Pectineal surface, this is the pectineal surface. Pectineal surface is covered by pectineus muscle. Pelvic surface is the posterior surface. Pelvic surface is crossed by ductus deferens in males and round ligament of uterus in females. So, the pelvic or the posterior surface is crossed by ductus deferens in males and round ligament of uterus in females. Here you can see a groove here. This is known as the obturator groove and it transmits obturator nerve and vessels. Lastly, we need to discuss about the ischium. Ischium is the posterior inferior bone or posterior inferior part of the hip bone. It has an upper end which forms the posterior inferior 2/5 of the acetabulum. It has a body and it has a ramus here. So, the upper end is forming the acetabulum, the lower end is forming the tuberosity and the lower part of the obturator foramen and a ramus. The ischium has 3 borders and 3 surfaces. It has an anterior border which is forming the posterior and the lower border of the obturator foramen, posterior border which is continuous with the posterior border of the ilium, and a lateral border which is just lateral to the anterior border. This is the lateral border, this is the anterior border, and this is the posterior border. And it has 3 surfaces: femoral surface which is between the anterior and the lateral border, this is the femoral surface. Then it has a dorsal surface which is between the lateral border and the posterior border, this is a dorsal surface. And it has a pelvic surface which is between the anterior and the posterior border, the backward. So, this was the ischium. It also has a roughened area or a prominence which is known as the ischial tuberosity, and it is also an important landmark for different attachments. Discussing about the ischium, okay, one thing we need to know this, that this is a prominence or a spine here. This is known as the ischial spine. So, it is also an important landmark for muscular and different attachments. Okay, so now we will discuss the attachments of ischium. First, starting with the ischial spine here. Ischial spine provides attachment to sacrospinous ligament and give origin to levator ani muscle. Now, we see a notch here just below the ischial spine. This is the lesser sciatic notch. If you can appreciate this notch here, this is the lesser sciatic notch. It is occupied by the tendon of obturator internus. If we look at the femoral surface here, femoral surface was between the anterior border and the lateral border. Femoral surface gives origin to obturator externus and quadratus femoris muscle. If we see the dorsal surface here, dorsal surface was between the lateral and the posterior border. So, the dorsal surface is related to piriformis muscle, the sciatic nerve, and nerve to quadratus femoris. If we look at the ischial tuberosity, this roughened area, ischial tuberosity gives origin to semimembranosus muscle, semitendinosus, biceps femoris, and adductor magnus. It also gives attachment to sacrotuberous ligament and ischiofemoral ligament. Now, the greater part of the pelvic surface of ischium gives origin to the obturator internus muscle. As you can see, this is the pubis bone and this is the ischial bone. There is a joining part or adjoining part and just in the middle of the foramen, you can say, and you can feel it. It is thickened part which joins the part of the pubic and the ischium. So, both of them join just in the middle, which is known as the conjoint ischiopubic rami. And that conjoint rami it has an upper border, as you can see, a lower border, an outer surface and an inner surface. So, the upper border, this upper border which is forming the lower boundary or the lower margin of the obturator foramen, the upper border gives attachment to the obturator membrane. The lower border gives attachment to facial lata and superficial fascia or the Colles fascia. The outer surface of conjoint rami gives origin to obturator externus, adductor brevis, gracilis and adductor magnus. The inner surface gives attachment to origin to obturator internus, deep transversus perineae, ischiocavernosus muscle and superficial transverse perineae muscle. Coming towards the acetabulum, acetabulum is a deep cup shaped hemispherical cavity, you may say, which is the joining point of all the 3 parts of the hip bone, that is the ischium, the pubis and the ilium. The ilium is forming the upper 2/5 of the acetabulum, the pubis is forming the anterior 1/5 of the acetabulum, and the ischium is forming the posterior inferior 2/5 of the acetabulum. The acetabulum is the articulating part and it articulates with the femur to form the hip joint. It is deficient in its lower border and this is known as the acetabular notch. Lastly, we have a foramen here. As you can see, this is known as the obturator foramen and it transmits nerve, obturator nerve and obturator vessels. It is larger and oval shaped in males while it is smaller and triangular in females. Thank you.